Hello, my name is John Bernard Mazano, Vis ITY Block 1, and I am the second reporter. Right now, I will tackle about the types of natural methods, which are the use of breastfeeding or lactational amenorrhea method, and the coitus interruptus or the withdrawal or pulling out method. Lactation amenorrhea method or LAM. Lactation amenorrhea method is a way for breastfeeding to temporarily help prevent pregnancy. It must be used correctly to work. Lactation means your body is making breast milk, and amenorrhea means you aren't having a monthly period. Breastfeeding hormones may stop your body from releasing eggs. You can't get pregnant if you don't release an egg. So how well does LAM work, or the lactation amenorrhea method? Well, you can get pregnant as early as 1 month after having a baby. When not using LAM or another method of birth control, if no method or birth control is used, there's about an 85% chance of getting pregnant after 1 year of having sex. With perfect use, you follow the exact directions of all the time. LAM is 98% effective against pregnancy for the first 6 months after giving birth. Think about getting emergency contraception to help prevent pregnancy if you've not followed LAM correctly and you've had unprotected sex in the last 5 days. LAM doesn't protect you from the sexual transmitted infections or the STIs and HIV. Use a condom every time you have sex, anal, oral, or vaginal, to lower your risk of STIs and HIV. So when can I use LAM as a birth control? LAM only works if your baby is under 6 months old and the baby is fully breastfed. Baby gets no other liquid or food, not even water, or nearly fully breasted. Baby gets vitamins, water, or other fluids or nutrients once in a while, and they do not disrupt the frequency of feedings. And period has not returned. This means you have not had vaginal bleeding for 2 or more days in a row, not counting bleeding during the first 2 months after giving birth. LAM does not work if you don't have all 3 things above. Talk to your healthcare provider to see if LAM is right for you. So what are the benefits of LAM or the lactation amenorrhea method? Well, its benefits are it can work for up to 6 months after birth. It is effective right away. There are no added hormones that can affect your breast milk. There is no cost and no birth control supplies are needed. Breastfeeding has many other health benefits for you and your baby. What are the disadvantages of LAM? It may be difficult for some to fully or nearly fully breastfeed. Fertility can return quickly if breastfeeding is reduced. It's only effective for up to 6 months after you have your baby. That's all for the lactation amenorrhea method. So next is Coitus interruptus method. Coitus interruptus method, also known as withdrawal or is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. Coitus interruptus prevents sperm from entering the woman's vagina, thereby preventing contact between spermatozoa and the ovum. Coitus interruptus. Some benefits of coitus interruptus are That the method, if used correctly, does not affect breastfeeding and is always available for primary use or use as a backup method. In addition, coitus interruptus involves no economic cost or use of chemicals and has no directly associated health risks. Coitus interruptus does not protect against sexually transmitted disease or the STDs, including human immunodeficiency virus or the HIV. And when women uses this method should be concealed that consistent and correct use of the male latex condom reduces the risk for transmission of HIV and other STDs. Use of female condoms can provide protection for transmission of STDs, although that data are limited. Coitus interruptus is unforgiving of incorrect use, and its effectiveness depends on the willingness and ability of the couple to use withdrawal with every act of intercourse. Women with conditions that make pregnancy an acceptable risk should be advised that coitus interruptus might not be appropriate for them because its relatively higher typical use failure rates. This method might be appropriate for couples who are highly motivated and able to use this method effectively, with religious or philosophical reasons for not using other methods of contraception. Who need contraceptions immediately and have entered into a sexual act without alternative methods available. Who need a temporary method while waiting the start of another method, or who have intercourse infrequently. And that's all for my report. Thank you.